third year exploring the challenges and successes in the rare diseases field, including diagnosis and detection, testing, research hurdles and opportunities, and mental health challenges. We've also looked at finding solutions and exploring options to improve opportunities for both those researching and dealing with rare diseases. This year, we've shifted our focus to advocacy, and today we're going to discuss the stories we tell when it comes to rare disease and how advocates can use words to raise awareness, provide education, build relationships, and lobby for change.
Rare disease in particular, the way that I have experienced that word, I feel like most times that we use that word, we use it in quite a scientific context. And so, with that context in mind, I feel like rare disease is entirely appropriate to use because it is a rare condition, and many rare diseases do leave us with some sort of functional impairment, be it physical or neurological, or maybe something in between those lines, or both. So, yeah, I think the only thing I would say about, the use of rare disease would be that it's probably just not best to use it anywhere where it would make someone feel like they're less than someone else just because they have a rare disease and someone else doesn't.
There really is a wonderful community of people coming from different perspectives who are interested in rare diseases for various reasons. And this includes the leaders of the patient advocacy groups, but also medical professionals, the doctors who choose to devote their careers to focusing on rare diseases really are a special breed of people, and they're very, very supportive of the patient organizations and the patient communities. So I think if you can bring those folks together and public health experts, there have been some wonderful things written and said in presentations in recent years, including I'm thinking of one doctor in particular at CDC who's been very active in exploring this idea of rare diseases as a public health concern. So, I think once again, trying to get away from, even if we have to use the word rare, trying to get away from this idea that it's just something that happens infrequently to somebody else, but, bringing together this community of people who are either treating patients, doing research in the pharmaceutical industry, developing products for rare diseases.
Sure. Well, in the spirit of storytelling and the power of stories, I mean, one of the most famous stories of advocacy and NIH working together was way before my time, in the late 1980s. But it's a story I think that sticks with us, is the story of AIDS activists that came to the NIH campus to protest against policies that were keeping them from getting life-saving drugs outside of the auspices of a clinical trial, and held these incredibly visual. Obviously this was before Instagram, before we were all trying to create, these incredible visuals that you could photograph, but just an incredibly visual, incredibly theatric, and passionate protest that drew a ton of media attention, but also obviously the attention of NIH leaders, who I think finally resonated with what the advocates were asking for and invited them in and sat down with them. And that began a really productive conversation. And the advocates were, like so many disease advocates, incredibly well versed in the science, were not themselves scientists or having scientific training, but really wanted to learn, wanted to have that productive conversation.